Hello out there in lecture land. This is Deb Miller. I'm lecturing once again from my desk, and I just wanted to talk to you all today about NCLEX preparation. That's Module E. You will be tested on Module A through E in just a few weeks. So I wanted to talk about NCLEX prep, and you know, honestly, you've been doing or preparing for your NCLEX since the first day of class. I know it's hard to think back to that, but the first day of class you began preparing for your NCLEX examination, and yes, you've done a lot of hard work to get to this point, and you should be commended for that. Lots of hard work, lots of effort, and I applaud you all. You know, you've been working on this for a couple of years now. Okay, and so now we're coming down to the big finale, if you will. You're preparing to graduate and have been thinking about your NCLEX exam for quite some time, because I believe all of you have been doing NCLEX questions. I know the dreaded questions, but I promise you, in the end, that will pay off. At least that's our plan. All the literature states that you can never do too many NCLEX questions, okay? You know, it seems like it's too many, but you can never do too many, and wouldn't you want to arm yourself with whatever it takes to pass that big exam? So today I'm going to talk about NCLEX prep. We're going to talk about the test itself, and I want to focus on the test plan, the types of question, i.e. the content kinds of questions. You know, we'll talk about the different styles of questions, but mainly, you know, where they're getting their questions from, what areas should you be focused on, and certainly you all have you know, been taking your NCLEX questions weekly, and you know, you've done very well on that. There may be some areas, some content areas that you're weaker in, and you certainly want to focus on that as you prepare for your NCLEX. You all have taken the HESI exam, that first one, and as you've worked through your remediation, you have picked out areas. I'm certain you're able to see some of your weaker areas, and so those are the areas I want you to focus on. Not to say that you don't have to work on anything else, okay, but you do need to focus on your weak spots, because the NCLEX exam is a computer adaptive type test, and so, you know, we've all said, you know, don't let them see your weak spots. So, you know, if there's a particular area that is not your strength, they're going to continue to ask you questions to make certain that you are at what we call a standard, okay? So, anyhow, that's kind of what I want to talk to you all about today. And you can follow along, and hopefully this will make good sense to you. It's coming straight from your book. You know, your Nursing Today book is it's a thin book, and it's a good book. It's a book you might want to keep around for a little while till you get through your NCLEX, and certainly as you secure jobs, and it has lots of tips for those kinds of things. And so anyhow, I'm going to follow pretty much along the book, okay? I'm not going to read it to you, but we're going to hit some high notes and then talk a little bit about the content, okay? So first of all, your NCLEX, it's the National Council Licensure Examination for Registered Nurses. That's what that NCLEX stands for. So who prepares it, and why do we have to have it? Well, you know, the National Council of State Boards prepare these exams, and it's an exam with a standardized scoring. Everybody takes the same type of exam based on the same test plan, and I'm going to talk to you a little bit about the test plan and how they break it down. But it is a means of determining entry-level nursing. It's to make sure that you are practicing at a safe level. Okay, it's not saying that you're more advanced than someone else. When you pass your examination, that means you're practicing at a entry-level RN, okay? And the success, of course, is that you're granted a license to practice nursing in the state that you apply to. So if most of you are taking it in Alabama, then you take your test and you have a license to practice in Alabama. Several of you are taking your exam in another state, or you plan to work in another state. You'll need to contact the Board of Nursing in the state that you plan to practice in to find out what you need to do to secure a license in that state. Okay? So make certain that you do some research before it comes time to take your boards. Now, in just a couple of weeks, Miss Gentry is going to come to the class, and we're going to talk about applying for licensure. So we'll hit some of that in this content. However, she's going to go over all that with you so that you'll fill everything out correctly and won't be any hang-ups when it comes time to get notification to take your test, okay? So how will the Nurse Licensure Compact affect your license? It's like a driver's license, okay? A lot of you have said, can I practice in more than one state? Well, some states are compact states, meaning that, you know, if you take your license here, you just have to apply to those different, I mean, it'll give you an opportunity to practice in different states, maybe for more of a fee, but it just gives you an opportunity to practice in other states, okay? However, if you're in a compact state, and I think Tennessee is, you have to still comply with the Nurse Practice Act in the state that you're practicing. So in other words, let's say you get your license in Tennessee and you're going to practice in Tennessee and a couple other states. It is your responsibility as a registered nurse, as a practicing registered nurse, to know the Nurse Practice Act in the state that you're practicing. There may be some differences between roles and responsibilities, and certainly when you're delegating to other members of the healthcare team. So very important that you look into that and kind of explore those kinds of options, okay? So I mentioned the test plan just a little bit ago, and, you know, so what is that? Well, it's actually a blueprint, and it reflects, like I just said, entry-level practice. It doesn't mean you're advanced. It means that you have met the standard to practice at an entry level, okay? Now, I'll tell you this, and you probably already have heard this, you know, the test plan is researched every 3 years. So every 3 years they change that test plan a little bit based on the research. And so the last time it was changed a year ago, a lot of board scores across the nation went down, including ours, and because it got harder. It is harder to pass the NCLEX, and you know we don't want just anybody practicing in taking care of you, right, or your family members. So you want to know that if you've passed your exam, that means that you have met the standards. The standards for entry level practice, okay? And yes, it is hard. It is hard to pass. Whether they change it or not, it's a hard exam. And so you want to do everything you can to prepare yourself. And there are some things that that are just seem maybe simple, or maybe some might think it's trivial, but it's not. It's just a matter of getting yourself prepared mentally to take the exam. And we're going to talk about some test taking tips. And, you know, we kind of use these tips even for your unit exams, if you will. But this is the big one. So, anyhow, let's talk about the test itself, okay? It's a computer adaptive type test, okay? And so what does that mean? It means different questions for each candidate. Now, we're all getting about the same kind of questions, but not the exact same kind, because it's adaptive to the person taking the test, okay? The questions are based on the candidate's responses, so however you respond, those are the kind of questions you'll get next, okay? Now, questions get progressively more difficult. Pre-test items are integrated into the exam to determine their validity and difficulty level, but those aren't scored. So you may have heard that, you know, there's some practice type questions. Yes, that's true. Those are pre-test items, and so they have to test them out in order to know whether they're valid type questions, so that they'll put them on future exams that will count, will be scored, okay? But backing up just a little bit, the questions do get more difficult, and as you answer those successfully, then they'll move on to something else, okay? So I've had students that said, you know, the first few questions were very hard, and then all of a sudden I settled down, and they got easier, and then they got a little harder again, then they got easier, and then they got a little harder again. So they were answering the way they needed to answer, and that person passed their boards with, I think, like 78 questions, and so that's a great thing, okay? So computer testing continued. What's the application process? Well, I will it's here on the slide, but I will tell you this. We'll go over all of this in great detail when Miss Gentry comes in and talks to you all in a couple of weeks, okay? But, you know, we have to fill out, you have to fill out the application. And there's a process, and every space has to be answered, meaning that if it says you have to answer these 5 questions, then you have to answer these 5 questions. You can't skip over things or oops, I forgot to answer that. It'll be kicked out, okay? So it's very important that you answer it appropriately and concisely, you know, completely, okay? So once you apply and we get this all going, and it's much easier now than it used to be, because you can do a lot of this application process online. And once you complete all that, certainly the nursing school has to verify your status. What that means is, after you take your finals and we've entered grades, the folks in the transcript office have to verify that you've completed all of your requirements for graduation, and then those transcripts are sent to the Board of Nursing. Now, that process doesn't happen overnight. It sometimes takes a couple of days, and then certainly once it gets to Montgomery, it takes, you know, upwards of a few weeks, okay? So it's not a overnight kind of thing or just a couple of days. So it is a process, and it's kind of as they receive them, kind of like a first come, first served basis, meaning that as they receive those transcripts in Montgomery at the Board of Nursing, that's how they evaluate them. So, you know, a lot of times students get real anxious because they haven't heard or they haven't gotten their notification to test. It's a process, and it does take a few weeks. You know, so when you graduate on the 16th, a lot of times students want to give their potential or future employer a start date. They don't necessarily want to start you until you have your temporary license, and some won't even start you until you have your actual license. And so, you know, we tell students, don't think, it'll take at least 2 or 3, maybe even 4 weeks to get your temporary license or your notification to test, okay? So understand it is a process, okay? You will receive authorization to test. That's your ATT, authorization to test, and then you'll schedule your exam. Now, I'm going to stop right there. On scheduling your exam, you make that schedule. You decide when you're going to take. And I want to encourage every single person to take it as soon as you get your notification to test. Don't put it off thinking, well, I'm going to study a little bit longer. You need to strike while the iron is hot and go ahead and schedule your exam and get on with it, okay? Because, you know, we'll have every intentions of sitting down and studying, but, you know, I've started this new job and I'm in orientation and, you know, one thing after another, or I've got this big family vacation. You know what? Wouldn't it be nice to enjoy your vacation knowing you've already taken your test, you've already passed your test, and you're not having to drag books with you? So keep that in mind when you schedule your exam. And you don't schedule your exam knowing that you might have a doctor's appointment or you might have to pick the kids up from, you know, summer camp. Don't do that. You're going to etch out that day. That's your day to test. And so you don't want to cloud it or complicate it with other things on the schedule for the day, okay? So you pick the day that's best for you. When and where am I going to test? There's testing sites in all states, and as I said, we'll give you that information when we go over all the licensure. Okay? You can only be licensed in the state where your application's submitted, so if you submit your application in Alabama, that's where you're going to be licensed, okay? You try to take the exam again shortly after graduation. That's just very important. Okay, so here's a big question. How much time do I have, and how many questions are there? You have up to 6 hours, and if there's special considerations or whatever, special instances, you'll have to contact the board and ask for that. But it's anywhere from 75 to 265 questions. Now, let me just say this. Well, it says it here. Number of questions you answer and the length of time that you test do not indicate if you have passed or failed. A lot of students are under the assumption, I got 75 questions. I know I passed. That's not necessarily the case. And on the flip of that, I got 265 questions. I'm sure I failed. That's not the case. Sometimes, you know, randomly, candidates are selected to take all of the questions. So it doesn't mean that you are below the standards on any one area, okay? It just means you were the lucky one that gets to take them all. But you have 6 hours, and oftentimes students will say, oh, it turned off at 75, I just needed to keep going. Well, you know, in most instances, you probably did fine. However, that's not necessarily the case. It doesn't mean that you certainly passed at 75 or you certainly failed at 265, because I've seen it both ways, okay? Do I have to be computer literate? Prior computer experience is not a prerequisite for passing, okay? You do have to be able to, you know, work the computer, the mouse and such. And folks, we've been doing that with these questions, okay? So that part shouldn't be a concern. And if you have issues with the equipment before you start your exam, you just have to ask the administrator, the test proctor person there. You'll just have to ask them. So as they let you in there and they start scanning you and doing all that work, if you see that you have a question about the equipment, you need to ask them before you start, okay? So, and that's what they're there for, to help you, okay? So what's the passing score? Same passing criteria for all the states. It's pass or fail. There's no number to reflect this, so you know, it's not going to say you made a 95.2, okay? It's not going to say that. It's just going to say you have passed. You have met the standard. You've either met or above the passing standard for all of the areas of content, okay? And we're going to break that down, and I'll tell you about that in a little bit. So how am I going to know? Well, you can always check the candidate bulletin. And, you know, I hope that you all have taken an opportunity to go into the Alabama Board of Nursing website. You need to familiarize yourself with that site, because that is where you're going to find out whether you passed. That is where you're going to go to renew your license, to enter your continuing education CEUs. You know, so you need to familiarize yourself. There is a tab that says FAQ, frequently asked questions. You need to go in there and look at that. So familiarize yourself with your Board of Nursing website. If it's not Alabama, whatever state it is, familiarize yourself with that. Results available online. Very few people, I don't know that they use a telephone, but there may be some states that they do. But I dare say, because it's hard to discern the person you're talking to via telephone. Okay, so, you know, they're not going to give out information to just anybody. So you can go online, and here's a big one. Don't call the State Board of Nursing or the testing site to find out if they've graded your test, okay? And I know that you all know, and you've heard that there's some little trick. Once you've registered and taken your exam in 24 hours, you can go in and try to register and it won't let you. And that means you probably passed. Well, you know, that's been around for several years now, and I don't know how reliable that will continue to be. Now, if you've probably heard this too, usually in 48 to 72 hours you can find your results online, okay? You know, although they're grading it as you are taking the test, it goes through a second grading review, if you will. So it's not immediately. You don't get your results immediately. So, you know, it usually takes a couple of days, okay? What kind of questions will be on the NCLEX? Well, a lot of them is going to be multiple choice with 4 options. There are alternate format test items, and those are, you know, like the drag and drops, the put them in order, the hot spots. There's lots of different styles of questions now. Each question stands alone, and there's only one correct answer. Okay, you know, you can't fight with NCLEX. All right, it's one answer and one answer only, okay? Now, there will be select all that apply. I'm telling you right up front, I've had several students who have come back and said, you know, they have had select all that apply. Like one student in particular told me she had 82 questions, and she really thought that 50 of them, if not 60, were select all that apply. Doesn't mean that she wasn't good at that. It just means that's the kind of question she got. So, you know, be prepared for that and don't get discouraged, okay? You will have some questions where you're just going to fill in the blank, like your med questions. You know, you may have some calculations, and so you'll have to fill in that number. If anything, my suggestion and my advice to you is, when you sit down to start your exam, take a deep breath. Remember these rules. Take a deep breath and let it go, okay? if you've done your part and you've prepared, and you all have, you'll be fine. But if you start panicking and second-guessing yourself, it's not going to go well for you, okay? So just take a deep breath and relax, okay? There is a tutorial that is at the beginning of your exam, okay? It talks about how to answer the questions. It doesn't give you any content-related information, but it gives you information for answering those questions. And so it's very important that you follow that tutorial. I've had several students that said, I'm glad I went through that tutorial. Usually I don't. But what it did for them was it helped calm them down before they actually started their exam, but it also talked about the different styles of questions and how to answer them. So that's some things for you to consider. Okay? What if I need to change the date or time after I've already scheduled it? You can change it within 24 hours before the actual appointment, but if you miss it, you've got to re-register and pay the fees again. Okay? And yes, we've had students who have had emergencies beyond your control, but that's just unfortunate, but you still have to re-register and pay the fee again, okay? Don't miss your exam because you forgot your ID. Don't miss your exam because you thought you knew where it was at and you got lost, or you ran out of gas, or that kind of thing. When we talk about preparing for the exam, I'm going to go over that with you, okay? Just some tips. More about the actual testing site, if you will. You're going to have one form of ID. It has to be valid. It can't be expired. It's got to have a picture and a signature. Now, folks if you have married since you got your license and your transcripts from the school has your married name, and all the information that we send on you has your married name, your license, your ID has to reflect that. So I would certainly make sure that happens long before you get to your testing center, okay? In other words, don't schedule your test knowing that you ain't got your new license in, okay? Or maybe, it's just real important that everything matches up, okay? So here's some forms of ID: your driver's license, a passport, but typically they want a driver's license or a military ID. They won't necessarily take your student ID, okay? And the literature that we're going to give you for applying for licensure, it spells it out black and white what they will and will not take, okay? One moment, please. Okay. Now, we're back. So, anyhow, we were talking about identification at the testing site. So, what are some of the advantages of the computer adaptive test for the test taker? Well, it's a quiet environment. You have a large work surface. You work at your own pace. Now, but remember, working at your own pace, you're still 6 hours is your limit, okay? And you're put in, like, small cubicles. So, you can't look... You're not going to be distracted necessarily from other testers, okay? So, it will be a quiet environment. So what about security? Well, it's very clear. It's very, very clear about what they will and will not accept for identification. Once you get there, there's a process, and you'll want to get there at least 30 minutes before your scheduled time to test, because there's, a process. They fingerprint you, their signatures, they photograph you, and then the palm, they'll read, the palm readers. They want to make sure that you are the person taking the test that's supposed to be taking the test, okay? If you have to take a break for whatever reason, whether it's to go to the bathroom, take a deep breath, whatever, you have to raise your hand, and the proctor will allow you to take a break. But, they're real secure there, and they're not going to let you bring your notes in or anything. And folks, let me just say this about that. You don't need your notes at that point. You do not need your notes at that point. You leave your notes at home. Don't bring a notebook. Don't bring your NCLEX book. Don't. You leave that at home, okay? You're going to leave your cell phone in the car. They'll have a little locker for you to lock your business up in, like your purse and all, because you're going to need your ID. But, you're not going to be able to keep your phone on you. You can't wear a hoodie and that kind of thing, okay? The real, it's very secure. It is very secure. So, just understand that, there's no wiggle room on that. Okay, so it's a very secure process. Prepping for the NCLEX exam. Okay, when and where should I start? Well, like I said, you've started prepping for your NCLEX exam, honestly, the first day of class. The first day you stepped on campus, you started working towards that, right? I mean, certainly that was your big goal at the end, is to pass, graduate and pass your NCLEX, okay? Of course, the data says, 6 months prior to your NCLEX, you got to make sure the dates and deadlines, you have that process in mind. Now, luckily, now that we're in, I guess, in the new age, if you will, you get to test periodically, meaning that in the old age, the dark ages, when a lot of your instructors took their exams, the NCLEX, your RN exam, was only offered once a year, and yet everybody had to go down to Montgomery if you lived in Alabama, and it was a 2.5-day stint, meaning that we were tested for 2.5 days. And so everybody that graduated tested at the same time. Well, now that we're computerized and we've come a long way, baby, you can schedule and test pretty much whenever you want to, once you've met the criteria, if that makes sense. So you don't have to wait 6 months or, until everybody takes it. I promise you, I want you to make certain that you take it as soon as you get your notification to test, okay? Certainly you're going to look at review courses, and I've posted 3 review courses for you to consider, and stay tuned on that. I'll be providing as much information as I can in the very near future. You've got the dates, and the prices are pretty much the same across the board. And certainly you want to, you need to know that it's going to cost money to take your boards. It's going to cost money to take a review course, and we're going to have that price sheet available to you very soon too, so you can be thinking in those terms, okay? So when folks ask you, hey, what do you want for graduation? Money. Okay, that'll help you. It'll help pay for all these expenses that are coming on you all at once, okay? So about 2 months before your NCLEX, you tell your employer your anticipated test date. Now, these dates are certainly negotiable. Some of you have already started interviewing, and maybe some of you have secured a position. Well, they're going to ask you, like I said earlier, when are you available? Well, my plans are to take the NCLEX as soon as I can, and you have to decide whether or not you're going to secure a temporary license, or you're going to wait and just get your permanent license. And some employers, that's something you'll ask, do you accept temporary license as opposed to do I have to wait till I get my permanent license to give you a start date? So those are some questions you want to ask, okay? But you tell your employer when you're at the interview or they ask about start date, I graduate the 16th and I plan on taking it as soon as I can, okay? I have no reason to believe I'm going to hold up. Decide how you're going to get to the test site, and do you need to stay overnight? So, there's a lot of places in Alabama. We have students who drive to Tennessee to take it. We have, there's testing centers everywhere. We have folks that will drive to Birmingham. They test on Sundays. You'll be given a list of available test dates and sites. So, you'll be able to pick that, okay? Now, regardless, you need to do a drive-by to know exactly where you're testing. Don't think, I'll just leave the house early in the morning and make sure I get there okay. You need to go a couple of days beforehand so you know exactly where you're going. And, if you're going to have to travel longer distance, you might think about an overnight stay, or certainly make sure you got gas and you allow yourself ample time, because if it's going to happen, it's going to happen on the day that you don't need it to, okay? It says decide if you're going by yourself or with a group. Now let me share this with you, and this is in a later slide. I caution you on going with a group, and the reason I say that is not everybody tests at the same pace, and you don't want to be sitting there thinking, oh gosh, it's taken me so long to take my test, I bet they're out there waiting on me. Just like if you're out there waiting on somebody, you don't want to be sitting there having to wait. So you can schedule yourself on the same day, but take separate cars so that no one has to wait on the other person, and then you don't create stress on the person that is working at a different pace, okay? Certainly develop a plan for studying, and like I said, you've been doing that since day one, and we've been working on that NCLEX questions weekly, so I'm real pleased with your progress on that. You've done a great job. Certainly the day before the big day, make sure you have all your papers required for admission. Make a practice run to the testing site the evening before. Eat a light dinner that won't upset your stomach. Go to bed early. Don't study, cram, or party. Now, save your celebrations for afterwards, okay? Save your celebrations for afterwards. Get a good night's rest. It'll be hard to sleep. And don't take anything to make yourself sleep, because then you'll be too groggy and you'll have cobwebs in your head and won't be able to answer very well. Eat a well-balanced breakfast. I caution you on sweet rolls and coffee, because sweet rolls, brings your sugars up and then it boom drops it down, and coffee makes you jittery, make you have to go to the bathroom a lot. So don't do something so drastically different the morning of your exam. Do what you normally do. If you're one of these people that get up and walk around the block, then do that. That'll just calm you down. You stick with the same routine if possible. Dress comfortably, look nice. Don't go in there looking like you just rolled up out of bed. Go looking nice. You don't have to dress up, and you don't even have to put on makeup. But do dress comfortably. And again, get there about 30 minutes before your test, okay? Talking about review courses, you have to decide which one meets your needs the best and your budget, okay? Now, if you're taking a job, you have to decide, if you got to take off of work, because some of you are currently working and you may have to take off of work. Plan ahead and make that decision. Now, if you notice, we have HESI scheduled, and I'll get with you about the information as far as requiring one or the other, okay? But we have Kaplan Review, and Kaplan Review typically does tears down the questions, so it kind of helps you to understand what they're asking using a decision tree. Hearst Review is more of a content review, okay? So some students need both, meaning that some need content review and how to tear down the questions so I know what they're asking for. And I can tell you that HESI does both of those, okay? But I believe that you got to do something to prepare yourself for this exam, okay? Do something. So anyhow, when you're looking at review courses, you can decide, what fits your needs the best. And it talks about qualification of the instructors. You won't get to see that, but each review that we have scheduled here sends the most qualified instructors possible, and we've had good results. And so, the review courses are internationally known, and so they're not going to send just anybody that's not prepared or equipped to conduct a review course, okay? Some review courses are purely online, some are in person, some offer handbooks or handouts, workbooks, CDs. Let me share this with you. Regardless of what you do, if you decide that you're going to do a review course, then do the review course. Put your heart and soul into it. If you got to be here 3 days, then you make a decision to be here 3 days. And if they say these materials are available to you for the next 3 months, then do your part to utilize the materials that are available to you, okay? And ask questions. Ask questions, okay? Some folks prefer an online versus a live review, if you will. Our HESI, Hearst, and Kaplan, all three are live reviews, and I believe that some of them offer some online instruction after you've completed the live review, okay? Now, I will tell you this, all three of them talk about test-taking strategies and how to discern between the distractors, if you will, okay? Most of them are anywhere from 250 up to 500. I think the ones that we have here are right around 300. Usually, they're anywhere from 3 to 4 or 5 days. The ones we have selected are, you've seen online, they're mostly 3 and 4 days, okay? And yes, it's a long day, but it's time well spent. It's time well spent, okay? And luckily, we're offering all of them on our campus, so you don't have to worry about, securing a hotel room. Some of your classmates are choosing to attend other reviews. Maybe you're doing one in another state or certainly out of town. That's available to you. Okay, I mean, that's your choice as far as how you want to handle that. Now, when you're trying to decide on which review course, you look at what they have to offer. Is it just large class sizes, or is it just group work, or is it just answering questions? Again, you can have these websites, or you can go on the website for Kaplan, and you can go on the website for Hearst Review and HESI and look at their review courses. You can do your own research by going in and go to their website and look and see what they offer and how they conduct their reviews, and then you can make that decision. But I think we're going to require probably HESI, but let you pick one other. But just stay tuned on that. Okay? Certainly a review book. Well, a lot of folks want to go and start buying another book. Well, here's my philosophy. Use what you're comfortable with. Use what you know. Okay? So you've been working with Iggy, and you've been working with your Saunders Review. Some of you have a HESI review book. If that is what you're comfortable with, then continue to utilize those resources. If you just feel you got to have something new, then get something new. But with these review courses that you're going to take, you'll get some resources there, and that'll give you an opportunity to answer some different styles of questions from a different resource, okay? But if you just feel like you need to go buy a new review book, check out the table of contents. Look and see what kind of content is in that book and what kind of questions. See if they include some test-taking strategies, okay? So let's talk about test anxiety. How many of us have that? Show hands. Oh, yeah, okay, all right, yeah, there's few of us. Few of us have test anxiety. Remember, before every test, don't I usually say take a deep breath, blow it out, because if you don't, you fall out and hit your head? Okay, that's to help you relax, okay? Only the correct answers do you mark, okay? I know that sounds like Yoda, but only the correct answers do you mark. You just got to trust your instincts, have some confidence. Have some confidence that you've gotten this far. You just got to push ahead and be confident in your answers, okay? Be confident in the knowledge that you have gained. How to get rid of this test anxiety? Well, plan ahead. Study. As long as you know you have done everything you can, prepared yourself. I'm not saying study nonstop, 12 hours a day, every day. But if you legitimately studying 4 hours a day, couple hours a day, at least you've done your part, okay? Give yourself a break. Do something fun. Don't sit nonstop with your head in a book. Just like I said, if you're planning a big vacation after graduation, take your test before you go on vacation if you can. That way you can enjoy. You deserve a break, okay? So take your time. Take your time. Well, let's see what happened there. Okay. All right, here we go again. All right, don't cram. Now, some folks tell you that cramming is effective. It's up to you, okay? If you know you have studied all along, then there's no need to cram. But if you've put it off and put it off and put it off, you're going to have some difficulty, and then you'll start panicking because you're having to cram so much in. And remember, don't take your book with you to your exam. They're not going to let you bring it in, and you don't need it at that point, okay? So what kind of questions can I expect? Well, you're going to get most of them is going to be multiple choice. There's only going to be one correct answer, and we're going to focus on the nursing care, all right? Your NCLEX questions you've answered in your Saunders book, it's focused on nursing care. We're not so set on knowing all the pathophysiology. Yes, you need to know some of that, but you know what? When I look at a disease process, I think in terms of, as a nurse, why do I need to know about this? And as a nurse, what can I do about that? So you look at nursing care, okay? You look at the nursing care. There will be some alternate format types of questions. So they started including these back in 2003. They are more effective in assessing your competence, your entry-level nursing competence. Remember, that's all we're shooting for is entry-level nursing competence. That's the standard, okay? There's no preset number on NCLEX, okay? So meaning that we will only have 20 of these types of questions. We'll only have 10 types of questions. That's not what that means. You remember, it's a computer adaptive test, okay? And, they'll put in those alternate type questions as they need to. Now, you don't have to have any specialized, advanced nursing knowledge to answer these kinds of questions. It's asking you the same thing that a multiple choice is, just in a different style, okay? It's the same nursing concepts being tested, okay? So, you'll have fill in the blank. You may have a multiple response item. That's select all that apply. You may have a hot spot, a drag and drop. You might have to chart or exhibit an item. You may have some audio questions. And there may be some graphic options, okay? So those are just different types. Students typically don't come back and say they had a lot of audio, if any, or any of the graphic type options. What I'm currently hearing mostly is, the multiple choice, the select all that apply, the drag and drop, the ordering, which of these would you do first, second, third, and fourth, fill in the blank, those types of questions, okay? That's kind of what we're hearing the most of. So, what difference does test-taking strategies make? So, what's the big deal? I mean, it's knowing how to take the exam, and it's a skill that you've developed these past couple of years taking our tests, okay? You began using your strategies in nursing school, and some of you have had to change some of your strategies, right? And that makes sense. Sometimes we have to go to plan B and Z, remember? So, your strategies maybe have changed as you have acquired more knowledge. Would you agree? So maybe the way you answered questions back in 102 and such certainly is different how you answer questions now, okay? Because, the questions are not purely just knowledge-based questions that you're going to get on NCLEX. You're going to have, they're going to use Bloom's taxonomy. We're going to start with knowledge. You may have a few knowledge, but not many. It's mainly application and comprehension and analysis. It's a notch up. They're not going to ask you just strictly knowledge-type questions, because that's not assessing your competence. It's assessing that, okay, she can answer that question, but can you apply that knowledge? Okay, so that's the point of this. They're trying to see if you have the application, the knowledge to apply. Okay? So, strategies for answering multiple choice questions. Certainly, you're going to read the STEM carefully. You're going to try to discern, what's this question about? Get the information. You're going to look for critical words. Those critical words, always, never, okay? We got to be careful with those. When someone says, if it says always, you got to be careful with that. And typically, NCLEX is not going to use a lot of that kind of stuff. But you got to be able to look at the question, the STEM, and discern what they're asking, okay? Eliminate options that immediately aren't correct. Look for similarities, and look and evaluate priority type questions, okay? One rule of thumb is to select answers that focus on the client, because it's about nursing care, right? Some other test-taking tips, and this is, straight from your book. It's talking about NCLEX Hospital. Well, it's going to ask you questions that are based with the knowledge that you're going to be working in a hospital. Not to say they're not going to ask you a question about a community activity. In the past, students have come back to say that they've been asked stuff about setting up a community activity for folks who have high blood pressure, and you're responsible for gathering workers to help you set up this activity in the community. Well, you need to know that you got to be able to interact and collaborate with your community resources. It's about therapeutic communication, and it's also about client needs. So that's what they're focused on, is client needs. So if you set up this health fair, if you will, I think that's what the student said, it was health fair. If you're setting it up with how's that going to benefit your patient. Okay, so, but for the most part, the questions are focused on, you know, the NCLEX hospital, if you will, and we're focused on the clients. Okay, so that's what that's talking about. Everything's focused on the client. Certainly with med administration, you got to know all the rights. And you got to know about calling for assistance. You know, if it's something that you should be doing, then that's what you need to focus on. So if you look at a question and it's talking about, you know, who should you call, if indeed it's the nurse, keep in mind you are the nurse when you're answering these questions. So if it's calling for assistance, like you need to call the physician, that's one thing. But if it's something that the patient needs that you can do, keep that in mind. So those are test-taking tips as put out by NCLEX. Looking at positioning, and, you know, a lot of that has to do with positions of comfort and safety, okay? Setting priorities with groups of patients. You're going to be asked to prioritize which of these patients would you see first, which of these patients are you going to see last. Delegation and supervision, and we're going to talk a little bit about that. You know, we've talked about delegation. You never delegate something that you should do yourself, okay? So keep that in mind when you see a delegation type question, okay? And doctor's orders, you know, most oftentimes, they're going to ask you if a doctor's order is required. Well, it just depends on what they're asking, okay? If it's, you know, to walk the patient in the hallway and this patient is ambulatory, you know, ad lib or whatever, you don't need an order. If you've already got that order, they can get up and move. But if it's a medication order, then you do need a physician's order. If they're needing something for a fever, then you do. So when you're taking your test, if they're asking about an assessment question, then your choice needs to be an assessment, okay? If they're asking for an evaluation, then the stem of your answer needs to be dealing with an evaluation, okay? So, and it'll make a little more sense when we talk about the test plan itself, but, you know, you think, when you're answering questions, look and see what they're asking for. If they're asking for an assessment, then your answer should be an assessment type answer, if that makes sense. Okay? So let's talk about this test plan. Okay? It's a pretty big deal. You can certainly go on the website and see these things for yourself. It's again, it's based on Bloom's taxonomy, you know, working at, you know, knowledge level on up. The majority of your items, though, on your NCLEX exam are going to be application or higher. Okay, so you're going to have to, you know, do some great critical thinking, and again, it's not going to be all knowledge based. Okay. The test plan structure itself deals with client needs. Okay, and it's dependent on nursing actions and competencies, and it focuses on clients in all settings, okay? So your client needs categories are as follows: safe and effective care environment. So 17 to 23% of the questions that you will get are going to be dealing with management of care, okay? So management of care is providing and directing nursing care that enhances the care delivery setting to protect clients and healthcare personnel. Okay, so it's talking about healthcare, management of care for your patient. So some content that would go along with that, and you can jot these down, but just to give you an idea of what kind of questions they'd be asking about would be advanced directives. It might be establishing priorities. You might have some questions about assignment, delegation, and supervision, and that makes sense under management of care. It's how you're going to delegate the care to other healthcare members. It might talk about confidentiality or information security, legal and ethical responsibilities, performance improvement might fall under this category as well. Safety and infection control. 9 to 15% of your questions are going to come from that. And some content that would be included here would be like accident or an error, med error, injury prevention, home safety. They might ask you some questions dealing with handling hazardous or infectious materials. Certainly your standard precautions, your basic precautions, surgical asepsis, use of restraints, because that falls under safety, falls prevention, safe use of equipment. Other questions or other content would be reporting an incident. Okay, so those are some of the topics that would fall under that category. Health promotion and maintenance, 6 to 12% of your tests will cover those. Now, it's just not to say that it's going to be just strictly one or the other. It's going to be a blending of that, if you will. But some areas under health promotion and maintenance, it's going to focus on some growth and development principles, also on prevention and early detection of health problems. So some content would be the aging process. This is where you might get some of your OB questions, like your antepartum, your newborn care, postpartum. You might get health promotion and disease prevention types of questions. They'll ask you questions about health screening, high-risk behaviors, lifestyle choices, self-care. There may be techniques of physical assessment. Let me give you an example. A few years ago, a student said that they had a drag and drop, or a hot spot, if you will, on where you could hear a particular kind of murmur, and you're supposed to do the hot spot. Those are the kinds of questions that would be under health promotion and maintenance, if you will. Okay? Psychosocial integrity, 6 to 12% of your test would involve that, and that's the promotion and support of emotional, mental, and social well-being. So questions in this category are going to focus on abuse, neglect, maybe some behavioral interventions. Some of your a lot of your psychiatric nursing types of content will be in this area, would fall into this category, if you will. End-of-life care, grief and loss, and certainly other mental health concepts would fall into this category. Okay? The fourth category is your physiological integrity, basic care and comfort. That's just providing comfort and assistance in the performance of activities of daily living. So content that would fall into this category, and I'm just throwing this stuff out there so you can understand what this means, and if you go back in and look at your NCLEX questions, you'll see these areas mentioned. Also in your HESI remediation, all of these areas are mentioned, so you can see how that kind of content plays into this plan, if you will. But basic care and comfort, you may have questions about elimination, personal hygiene, rest and sleep, nutrition, assisted devices, pharmacological and parental therapies. Certainly that's 12 to 18% test. That's where we're going to talk about adverse reactions and side effects, particularly to your medications. Again, medication administration will fall here. You may have questions with regards to blood and blood products. Dosage calculations would fall into this category. Reduction of risk potential, anywhere from 9 to 15% of your tests would be questions in this kind of category. And you would have questions about lab values, diagnostic testing, maybe some therapeutic procedures. You might have questions regarding alterations in body systems, because it's reduction of risk potential. So you're going to be looking at, risk potentials and how you're going to reduce it. As a nurse, how am I going to care for this particular patient? Or if this particular patient has this disease process going on, I know I need to incorporate the following strategies to prevent further injury or further complications, okay? And then physiological adaptation. This is managing and providing care for clients with acute, chronic, or life-threatening physical health conditions. So fluid and electrolyte imbalances would fall into this category. Illness management, medical emergencies, hemodynamics, and maybe a little pathophysiology. So that's the breakdown. And I took this straight from the website. So this is the latest and greatest test plan, if you will, for breaking down the percentage of areas on your test. So looking at this, it's almost kind of even across the board, with management of care being the highest. And that makes good sense, doesn't it? Because we're providing care, we're managing care for that patient. So it stands to reason that, it's real important that we have that, that under our belt very clearly, okay? Because we're going to be directing patient care, whether it be conducting it ourselves or delegating it. So it's very important that we understand that. So as you prepare for your NCLEX and you're looking at your HESI remediation or some of your NCLEX questions that you're practicing, keep in mind that, you're going to have, this is how they're going to break it down. So a lot of times students will say, how do I know what questions they're going to ask me? Well, I don't know what questions they're going to ask you, but this is the test plan. So you're going to see that a lot of your questions are probably going to be based on management of care. Not to say you won't have some that are talking about risk reduction. And certainly as a nurse, when you talk about management of care, you have to talk about safety and infection control. And certainly risk reduction falls into that as well. So that's just a breakdown for you to consider as you prepare and look at remediation that you perhaps have gone back and reviewed. Again, just a little recap. Management of care, you're going to see diagnostic tests. You're going to see some leadership questions, because when you're managing care, then we've got to talk about leadership. Certainly safety and infection control, safety issues regarding restraints, med administration. You want to talk about isolation precautions and preventing infections, okay? And then health promotion and maintenance. Again, that's going to be dealing with your growth and development. That's where your OB questions are going to come in. Your psychosocial, that's your mental health concepts, coping mechanisms, crisis management. So those are some topics. Your physiological integrity, certainly basic care and comfort. It's assisting with activities of daily living. Your pharmacological and parenteral therapies, we're going to certainly keep in mind dosage calculations. And, students every now and again will come back and say, I only had one dosage calculation, or I didn't have any. So it's just the luck of the draw. And if you answer them correctly, maybe you won't get so many, but you do need to be certain that you know how to, correctly calculate dosages. Okay? Reduction of risk potential. We've talked about that. Falls prevention. Think in terms of preventing complications from surgery and such. Physiological adaptation. Again, medical emergencies and fluid electrolyte. Okay? Now, for your testing purposes, I'm not going to say, where would I find this under what category? I'm not going to ask you that. I want you to be aware of what kinds of questions you will see on your boards, okay? So, all that to say is that there are integrated processes when it comes to developing the exam, okay? And all of these, like I said, are integrated. And it is blended throughout. Certainly it stands to reason you're going to have the nursing process, right? The nursing process is going to be woven through all of these client need categories as well as the subcategories, okay? So you're not going to get just a name the nursing process kind of question. You're going to have questions that's dealing with assessment, planning, implementation, and evaluation. As a nurse, it's our responsibility to evaluate the plan of care, evaluate what our patient, how do they tolerate that procedure or that medication and such. So be sure you have the nursing process under your belt. And I know you do because we've been working with that since day one. Caring. This is another integrated process. It's certainly the interaction of the nurse and the client in an atmosphere of mutual respect and trust. In this collaborative environment, the nurse provides encouragement, hope, support, and compassion to help achieve desired outcomes. Think about therapeutic communication. Think about how you're going to communicate with your patient and establish those trusting relationships that we talked about back in 102. That's going to be woven throughout. And certainly communication and documentation. We've talked about therapeutic communication. We've talked about electronic types of communication and documentation. If it's not documented, then it didn't happen. And later in the week, we're going to have a guest lecturer that's going to talk a little bit about the legal and ethical ramifications of inaccurate or inadequate documentation. And I think it'll be beneficial. We're going to record it on Integrity, but it's going to be beneficial for you all to understand that the questions that you're asked on your NCLEX are going to incorporate all of these processes. Teaching and learning, that's what we do as nurses, okay? And certainly as a nurse, we facilitate the knowledge and the skills and certainly our attitude in promoting a change in behavior. So it's how we communicate and teach our patients will impact the outcome. Does that make sense? So keep in mind teaching and learning, and think back to Nursing 201. You did a teaching learning plan with your patient. You taught them something, and I'm certain that the outcome was great, and they learned from your experience and your knowledge. So as a nurse, it's important that we utilize the nursing process. It's important that we care for our patients. By caring for our patients, we're going to be able to communicate with both the patients and other members of the healthcare team, and we have to document. That is such an important part of what we do, and how we communicate the care we have given is through our documentation and teaching and learning. I mean, we're always teaching at the bedside, whether it be our patient or the patient's families or other members of the healthcare team. That's a very important process. And all of these are integrated into the test plan and it's carried over in all those subcategories, the management of care and the risk reduction. So that's how they outline those questions, okay? So, that's a mouthful, huh? It's lots to take in, but I just wanted to have the conversation about how they come up with the exam and what kinds of questions and what kind of content that you should be thinking about. Again, I'd go back and look at my my HESI exams and any content that's been low or hadn't been my strong suit, I'd go back and hit that first. And keep in mind that as you answer questions, you're answering as though you are the nurse, and you're going to deliver care based on that, meaning that you're not going to delegate anything off that you should be doing yourself. Okay? So, enough about that. Here's some tips for getting ready for that exam. And this is for any exam, and we've talked about it already, but it's worth repeating. Certainly go to bed early the night before the exam. Don't sit up all night long trying to cram in that last little bit, because you don't need to. You need to have a good night's rest so you feel rested. You're already going to be nervous, and I know that. So, but at least you're rested, okay? Avoid, bunch of cocktails the night before. That's not good. That makes you cloudy. Eat a well-balanced breakfast, and I know there's folks in this room that say, I never eat breakfast. Well, eat a little something. You don't want your blood sugar to drop out, but you don't want to be so hungry you can't think, okay? Dress comfortably in layers and arrive early, okay? There's nothing worse than thinking you know where it's at, and then, I thought it was a left turn, but it really was a right turn. Then you're late, or you're rushed getting there, okay? Again, don't go with family or friends. In other words, don't bring your neighborhood, don't bring your friend to come sit with you, or your family or your children. They need to stay at home. If you're going with a classmate, you probably want to consider, like I said earlier, take a separate car, so that you don't have to wait on each other. And then you can hook up later to just, talk about it. And they'll tell you you're not to divulge any of the questions and that kind of thing, because it's test security. Don't be so concerned with the number of questions, and don't put in your mind, if I get 76 questions, I'm just going to fall apart. Don't panic when you get to 76. Just keep on going. Like I said, some folks will get all 265, and it doesn't mean that you're doing a poor job. It just means you got all 265. Don't look for a pattern of the answers or try to decide the level of difficulty. Don't second-guess yourself either, okay? Don't spend time trying to think, you know what, I've had 5 of these kind of questions. Now it's time for this kind of question. Don't. Just take them one question at a time, answer it, and move on. Now, once you answer and hit enter, it won't let you go back, okay? So, you need to answer it and move on, okay? Keep your steady pace. And if you need a break, you have to raise your hand, and your proctor will let you come on. She'll let you go to the bathroom and such. Read the question stem carefully. Evaluate all your options in a systematic manner. Again, this is a repeat, but it bears repeating, okay? Eliminate options you know are not correct. And even on our test, you can look and say, well, those 2 are ridiculous. Let's throw those out. And then I hear you all say, I get down to 2. And then I can't decide. Well, go back to the question and read it again and know what the stem of the question is asking. Choose the most global answer. Focus on the client. Focus on your patient. Look at any similarities, and you'll find one that's different. And you base it on the most ideal situation. Don't base it on what we do at work, or this is what I would do. Don't base it on how we do that at work or how we did it yesterday. You base it on what you know is right, okay? There's no shortcuts when you're taking your NCLEX, okay? Evaluate priority questions based on the nursing process and Maslow's hierarchy of needs, okay? So when you're prioritizing, look at it all and decide based on hierarchy of needs, and look at the nursing process, okay? That's how you get those priority questions correct. Look for qualifying words of the stem. Look for negatives in the stem, and you throw those out. Avoid answers with absolutes. And again, you're going to treat each question individually. And you know what? If you don't know what it is, just guess. It's better than no answer, and it won't let you proceed to the next one until you answer it. So, it's better to guess, because you might guess right, and if you don't, you're not going to be penalized. You're just going to keep getting more questions, okay? Trust your intuition. Trust your gut. Trust your gut, okay? You all know that, your first thought is usually your correct one. You know that. And it's when you start going back and changing, although you can't change once you submit and move on, but you know that once you start second-guessing yourself, you're going to talk yourself out of the right answer. Okay? So trust your instincts. Again, select answers that focus on the patient rather than the equipment. If it's asking for a hospital policy or a rule or something along those lines, that's one thing. But we're focusing on the patient. You nurse the patient, not the machine. Selecting call the physician is rarely the correct answer. Identify the best nursing intervention. That's what it's about. Nursing intervention, nursing practice, okay? Not to say that might not be the answer, but don't always pick that first. Read and look and see what they're asking for, okay? Regarding delegation questions, do not delegate teaching or evaluating responsibilities. Okay? So if it's to evaluate something, you're the nurse, it's your responsibility. If it's teaching, discharge instructions, you're the nurse, you've got to do that. You can delegate, though, the most stable patient with the most predictable response to care. You can delegate tasks to the best suited team member, okay? So keep that in mind. It's okay to delegate, but be careful what you're delegating. If it's stuff that only you can do or you need to be doing based on the patient's circumstances, then you have to do it, okay? You don't delegate. Excuse me. Okay, she's doing the happy dance. It's the passage of NCLEX indicates that a nurse has attained the minimal level of competency necessary to practice nursing safely. See, she's just doing the happy dance. Some other tips: be prepared. The night before, you're gonna get your stuff together. Put your ID, put all the paperwork you need with something you're going to put on. Now, make sure there's gas in the car. Make sure there's air in the tires. Get up a little early so if there is something going on, at least you've got time to fix it, okay? Make sure you got your keys. One time I had a student who had graduated. She called me. She was in a panic. Her husband took the keys to the car, the only set. So she had no way to get there. So she had to reschedule. So don't let that happen. Plan ahead. And if it's storming, for heaven's sakes, if it's storming, give yourself ample time to get there, okay? Allow extra time in case, there's, fender benders and such, okay? Be prepared, to have your picture taken. They're going to do a palm scan. You got your ID. Certainly you're going to be given an erasable dry erase board kind of thing. You can't take paper in there. Your calculator will be on the computer, so you won't need to bring any of that information with you, okay, or that equipment. They'll take care of all that for you, okay? And certainly when you're done, you raise your hand and you'll be dismissed by the testing administrator, okay? So you can't just get up and leave. You have to raise your hand, okay? And like I said, they're proctoring you nonstop, okay? Let's see. Let me give this picture. There you go. Certainly, some other tips, if you will. Know your normals. If it's lab questions, well, you need to know your normal lab values. You need to know what's normal vital signs, okay? Always assess before you implement, okay? When you're answering these NCLEX questions, assess before you implement, okay? Think patient safety. When you're answering these questions, is this safe for the patient? Is this something I can do? Is this something that needs to be done? So think patient safety, okay? Stay calm. Stay calm. Remember, have some confidence. Have some confidence. Now, follow your plan of study. If you know there's some weak areas identified based on your HESI exams, look at your remediation. Look at your remediation, and you'll know what you need to focus on. You know how to study. You've been doing it for at least 2 years. Have some confidence because you're about to become a registered nurse. How about that? That looks a little fuzzy, doesn't it? So, but anyhow, it's registered nurse. That's what you're all going to be, okay? You just got to have confidence. Got to have confidence in that. So, any questions? Any questions at all? And of course, I'm at my desk and you can't ask those questions, but the next time you see me, if you have any questions, I'd love to answer them. And if I don't have the answer, I'll get someone who does. Certainly, it's been a pleasure and it's been an honor, and I wish you all the very best. I'm going to upload this recording to Integrity, and you can listen to it at your leisure. And I will see you in class this week. Thank you very much.